We'll be discussing today about the congenital diseases of the larynx. And the first and most important one we're looking at is laryngomalacia. Okay, it is the most common congenital abnormality of the larynx. So, important question. Most common congenital abnormality of the larynx is laryngomalacia. It's nothing but a soft laryngeal cartilage. The laryngeal cartilage in these children is extra soft. Okay, so the clinical features: the patient presents with inspiratory stridor from birth. Cry is normal, but there is expiratory stridor. So crying increases stridor. Crying essentially is normal, but due to expiratory stridor, the crying increases stridor. And in prone position, stridor improves. Okay, so the child, when he or she is put in prone position, the stridor improves. And on examination, you can note over here, there is an omega shaped epiglottis. Okay. The treatment would be reassurance with conservative management. Why so? Because laryngomalacia disappears by 2 years of age. Okay. Now, the next one is the subglottic hemangioma. It is nothing but a vascular malformation, and the patient presents with stridor at the age of 3 to 6 months. What we will have to remember for the exam based on the type of stridor. If there is involvement of glottis and subglottis, there is biphasic stridor. When supraglottis and the structures above it are involved, there is inspiratory stridor, and when the structures below the subglottis are involved, there produces a expiratory stridor. But in subglottic hemangioma, there is inspiratory stridor due to the presence of vascular malformation. Okay. So the diagnosis will be via the fiberoptic laryngoscopy or direct laryngoscopy, and on examination you can find a reddish blue mass in the subglottis. Okay. The diagnosis, once confirmed, the treatment will be the most important one, the tracheostomy to save the airway, and carbon dioxide laser excision or injection of steroid or sclerotherapy for the vascular malformation. Now the third one and the last one we are looking at is the laryngeal web. It's nothing but a membrane formed due to incomplete canalization of the airway. See, you can note very beautifully over here the web. The most common site is the anterior glottis, and the patient presents with biphasic stridor from birth. Okay, web has B, so that is for B, biphasic stridor from birth. On examination, you can obviously note the web, and there are two types. It can be congenital or acquired. Congenital web is cartilaginous, whereas acquired web, that is most commonly occurring due to long-term intubation, is usually a membranous structure. The treatment will be carbon dioxide laser excision with silicone placed between vocal folds for few weeks to months to prevent recurrence. Okay, so carbon dioxide laser excision